understand kidneys. Okay, when we are looking at the kidneys, first question is identifying the structure organ. Okay, we know that kidneys are easy to identify. Sometimes as we see spleen, kidneys almost look very much similar in structure, but try to see that it has a lot of structures, veins and arteries which are entering into its pelvis. It has two surfaces which are nicely solid structures. It has two borders, we can see that very clearly. So we can make out the difference between spleen, kidneys. Okay, we have got such students who get confused between kidneys and spleen as well. So now let us look at this. These are the kidneys. Okay, second question is how to identify the side of the kidney. Now easiest way to identify, first thing is look at the structures. All structures should be on the medial side. Now this is the lateral border, this is the medial border. Medial border contains hilum and hilar structures. Which is the upper pole and which is the lower pole? How to identify that? So if you keep it on this side, okay, if you keep it like this opposite way, you can see that the contents, most important is your renal pelvis becoming ureter. Okay, so first identify the ureter. Ureter should always go down. So you can see that this ureter is passing downwards. So when we keep ureter downwards, you can automatically get which is the lower pole and which is the upper pole. Now we have lateral border, medial border, upper pole, lower pole. Now I can keep this in this position as well. It can become left side or right side. How to identify which is the anterior surface and which is the posterior surface? Now let us take a clear look at this picture. Anterior surface is nicely concave, you can see that it is upwards, okay, bulged, whereas posterior surface is flat. Okay, why it is flat? Because it is lying on the posterior abdominal wall muscles. We have posterior abdominal wall muscles, big muscles which are like psoas major and quadratus lumborum. So this is taking rest or being on these muscles for a longer time, so obviously posterior surface is flatter. But if you see anterior surface, it is nicely, you can see nice elevation here. So this is the anterior surface, this is the posterior surface, this is the lateral border, this is the medial border, this is the upper pole and lower pole, which gives our position of the ureter. So this gives which side kidney it belongs to. This is our right side kidney. Now let us identify the contents at the hilum. When you take a clear look at the hilum, just understand how the structures are. See, when you hold the structures, you can see that the artery is more thicker and you can see that it is more patent. Venous structures, thin walled, okay, and these are just patent because they are having that connections which are entering into the kidney. If I remove of this structure, they will be easily collapsible. So here we can see renal vein, tributaries, renal artery branches. You can see this is the renal artery, and finally we have pelvis. You can see this is the renal pelvis which continues as ureter. Okay, so we can see vein, artery and ureter. Okay, these are the structures of the kidney.